Okay, hi, my name is Cami Hope. I'm a DNP student at Murray State University. This is Evan. She's going to be my volunteer today to do a cerebellar and sensory exam. So first, Evan, what I'm going to have you do is walk towards me and walk back where you are. Wonderful. Okay, her gait is smooth, even, and balanced and symmetrical bilaterally. Next, what I'll have you do is close your eyes, put your arms by your side and your feet together. Okay, Romberg test is negative. She did not sway or fall over. Next, I'm going to have you do is stand on one foot and hop up and down for me. Okay, we'll do it on the other side. Okay, great. Now what I want you to do is do deep knee bends, okay? Just do a couple of them for me. Wonderful. So that all of that is intact. Next one I have you do is do a fine motor coordination. So I'm going to go ahead and have you sit down. All right, what I want you to do is go ahead and touch each one of your thumbs to your fingers. Okay, do it again for me, please. Okay, next I'm going to have you do is put your heel towards your shin and go up and down your shin for me. Okay, repeat on the other side. Okay, your fine motor coordination is intact. Next I'm going to have you do is we're going to do your sensation in your upper extremities. I want you to go ahead and close your eyes for me and let me know if what you're feeling is sharp or dull.
Dull. Sharp. Dull. Sharp.
Okay, great. And then what I'm going to have you do is I'm going to have you close your eyes. I'm going to put this tuning fork on your hand, and I want you to let me know when you feel it and when you stop feeling it.
Okay.
Okay?
I feel it. Okay.
Okay, great. Now we're going to do the same thing on the other side.
I feel it.
Okay, great. So you did great on that. Next, we're going to go to your lower extremities and do the same test. Okay, so go ahead and keep your eyes closed for me. Let me know what you feel is dull or sharp.
Dull. Sharp. Sharp. Dull.
Okay. We're going to do the tuning fork test same on the same side as well, okay? So go ahead and keep your eyes closed. Let me know when you feel it and whenever you don't feel it anymore.
Okay. I can feel it. It's gone.
Okay, now we'll do it on the other side.
Now I can feel it.
Okay. You know when you don't feel it anymore?
I don't feel it anymore.
Okay, great. Now what I'm going to have you do is close your eyes, and I want you to identify the item that is in your hand. Okay, I'm going to test your stereognosis. Okay.
Nail polish.
Wonderful. That's up in your left hand now. Again, keep your eyes closed and identify what it is.
Key.
Great. And now continue to keep your eyes closed, and I'm going to write a number in each one of your hands, and I want you to say the number that you feel, okay?
Okay. 8. 3.
3. Wonderful. Okay, so she was able to repeat all that and correctly identify the objects. Next thing I'm going to go ahead and have you do is test your deep tendon reflexes. I'm going to go ahead and support your arm here, okay? I'm going to test you for your brachial radialis. Okay, great. That was obviously intact. Let's go ahead and do the other side here. Okay, that was also intact. I'm going to go ahead and test her bicep here. Go ahead and keep your arm bent. I'll support your arm here with the brachial tendon. Okay. Okay. That one was intact. Go ahead and do the other side. Okay, wonderful. Biceps reflexes are intact. I'm going to go ahead and do your tricep here, okay? Okay, that one was intact. Okay, so for bilateral brachioradialis, bicep and tricep reflexes were present. Next, I'm going to test your patellar reflexes. Don't be afraid to kick me, okay? If it happens, it happens. Okay, right one was present. Left patellar reflex is present. Next, I'm going to do your Achilles. I'm going to support your foot here. I'm going to strike above the Achilles heel, or right at the Achilles heel here. Okay, wonderful. That one is intact. And her left Achilles reflex is intact. Next, I'm going to have what we're going to do is test your Babinski and patellar your Babinski reflex. So I'm just going to kind of hold your foot up here for me, okay? Okay, her toes flexed. She had a positive Babinski's. Okay. Sorry, did that hurt? Oh, tickles. Okay, I should have warned you. Her toes also flex for that. So she has all of her reflexes intact as well as her Babinski reflex is normal. Thank you for watching. Okay, hi, this is Cami. I'm a DNP student at Murray State, and this is my cranial nerve exam. This is Evan, my volunteer. She already consented to be taped, and we're going to go ahead and assess your cranial nerves, okay? First, I'm going to test your olfactory nerve. So what I want you to do is to close your eyes for me and close one of your nostrils, and I want you to identify the smell if you can.
Cinnamon.
Wonderful. Now, go ahead and close the other nostril. Keep your eyes closed and let me know what you smell.
Alcohol.
Okay, great. Next, I'm going to go ahead and test your optic nerve. What I want you to do is close one of your eyes and cover it up with your hand.
Okay.
Keep the other eye open. There we go. And let me know what number you see when I enter your peripheral vision area. Okay. Look, continue looking straight at me. Yeah, you're fine. I didn't prompt you on that. Look straight at me. Okay. The entire time.
2. 1.
Okay. Cover up the other eye. There we go.
2. 1.
So normally she would have an intact optic nerve. All right.
So hard.
No, I know it's empty. Okay, so the next one I'm going to test is the oculomotor, trochlear, and abducens cranial nerves. So what I want you to do is to focus straight, look straight at me, and move your eyes with my finger.
Okay.
Okay. Okay, patient have parallel tracking with her eyes, known as cygnus noted. Next, what I'm going to do is do the cover uncover test with my piece of paper. All right, what I want you to do is just continue to look straight at me.
Okay.
Okay? Okay, the uncover test and cover test was normal and intact. She did not have any deviation or inward or outward with her eyes. Next thing I'm going to take a look at is your trigeminal nerve. So what I want you to do is go ahead and clench your teeth for me. I'm going to feel for your temporal and masseter muscles here. Okay, good strong muscle contraction bilaterally. Next one I have you do is close your eyes, and I want you to tell me if what you feel is sharp or dull.
Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay, great. Trigeminal nerve is intact. Next, we're going to do the facial nerve, cranial nerve. So what I'm going to have you do is do some exaggerated facial expressions. First, can you raise your eyebrows for me? Okay, great. Now purse your lips as if you're going to whistle. Puff your cheeks out. Okay. Go ahead and smile without showing your teeth. Frown. Okay, great. So all of her her face was symmetrical during all of the expressions. Facial nerve is intact. Next, what I'm going to test is your glossopharyngeal and vagus nerve.
Okay.
So what I want you to do is go ahead and open up your mouth for me. Okay. Go ahead and stick your tongue out if you can for me. Thank you. Now I can see better. Go ahead and say ah. Okay. Uvula is midline, soft palate, moved up and down as well as your uvula, which is appropriate for saying ah. Okay. Sorry, I should have warned you. Gag reflex is intact. Next, I'm going to go ahead and assess your swallowing reflex. So go ahead and have a sip of water and swallow for me, please. I gotcha. Any difficulty with that?
No.
Okay, swallowing reflex is intact. Next, I'm going to go ahead and test your spinal accessory muscles.
Okay.
What I want you to do is when I press against your head, I want you to resist, okay? Push towards your left shoulder as you push against resistance. Now for the other side. Okay, now shrug. Okay, great. Her spinal accessory cranial nerve is intact. Next, I'm going to look at your hypoglossal.
Okay.
Okay, can you go ahead and stick your tongue out for me? Move it up and down, side to side, all around. Okay. So her hypoglossal cranial nerve is intact. That concludes my cranial nerve assessment. Okay, hi, my name is Cami Hope. I'm a DNP student at Murray State University, and this is my musculoskeletal exam. This is Evan, my volunteer. First, I want to start just commenting on her general appearance. Her shoulders appear to be symmetrical bilaterally, as do her iliac crest. I'm going to go ahead and have you turn around. Look at your cervical spine. Appears to be concave. Thoracic spine appears to be convex, and her lumbar spine has an appropriate curve to it as well. Next, I'm going to go ahead and have you bend down straight at the hips, dangle your arms. I'm going to assess for scoliosis and feel her spine. Spine is aligned and no signs of scoliosis. Next, I'm going to have you do is face me, and I'm going to look at your temporal mastoid joint, or your TMJ. So clench your teeth for me here. Okay, good, strong muscles bilaterally. Next, what I'm going to have you do is stick your jaw out for me. Now back towards you, side to side. Okay, wonderful. Full range of motion on the TMJ. Next, what I'm going to go ahead and have you do is do the cervical spine. So I want you to put your chin to your chest, head back, right ear towards the right shoulder, left ear towards the left shoulder. Wonderful. So what I'm going to have you do is do the chin to your right shoulder, chin to your left shoulder. Okay. So full range of motion on the cervical spine. Next, I'm going to have you do that with your whole spine. Okay, so go ahead and bend forward for me.
Right.
Bend back. Okay, yeah, without falling. Go from side to side. Okay, wonderful. Now I want you to twist your whole upper torso to your left and then your right. Great. Okay, so full range of motion on the spine. Any pain or tenderness during any of this exam so far? Okay, let me know if there is any pain or tenderness from here on out. Okay. Next, I'm going to have you do is do your bilateral upper extremities. So just commenting on her fingers, her wrists, her elbows and shoulders all have good muscle tone. They're warm, no crepitus felt or noted. Skin is clean, dry, warm, and intact. So looking at her fingers, they look good. Okay. What I'm going to have you do is, it says her range of motion on her fingers. So what I want you to do is spread your fingers out, make a fist, wave your fingers up and down. Okay, now do the same thing with your wrists, up and down, side to side. Okay, I'm going to have you flip your, keep your elbows flexed like that. Go up towards your shoulders, touch your shoulders. Now go down. Wonderful. Palms up and down. Okay, next to your shoulders, just repeat after me. It's a little bit easier, so put them up. Okay, down, laterally to the side. Okay, put your arms behind you, back and front, cross. Great. Okay, full range of motion noted on your shoulders. Any pain or tenderness?
No.
All right, great. So next one I'm going to have you do is put your hands towards your shoulders again as I meet resistance. Okay, now push down. Wonderful. Bilateral upper extremity strength is 5 out of 5. Next, I'm going to go ahead and assess your fingers. Go ahead and squeeze. There we go. Wonderful. Have your fingers spread out as I try to meet resistance. Okay, definitely full strength, 5 out of 5 on her wrist and her fingers. Next, I'm going to have you do is go ahead and sit down for me. All right. Next, I'm going to assess her hips, her knees, and her lower extremities with her ankle and feet. So just looking at the hips, the knee joints, ankle, and feet. No edema noted. Skin color is consistent, clean, dry, intact, warm, good muscle tone throughout. What I'm going to have you do is do range of motion with your feet. Okay, so put your feet up and down for me. Toes in towards each other and away. Okay, wonderful. Next, I'm going to have you put your legs out to test your knees. There we go, and back. Okay, great. Next, for the next one for your hips, I'm going to have you lay down. Okay, what I want you to do is raise your right leg straight for me, please. Okay, do the same for the other side. Wonderful. Now, what I want you to do is go from laterally, put your right leg out, left leg out. Great. Now I'm going to have you bend your right knee and put your foot down on the table. There we go. Put your right knee towards your left knee. Okay. Put your right heel on your knee and put your knee down to the table. Wonderful. Now we're going to repeat the same thing on the other side. Okay. So go ahead and put your left knee. Oh, yeah, left knee towards your right knee. There you go. Put your left heel onto your right knee and go down the table. Okay. Patient has full range of motion on her hips. Now I'm going to go ahead and test the strength of your hips, okay? Try to raise your right leg straight for me against resistance. Okay, same for the other side. Wonderful. Next, I'm going to go ahead and have you sit up. We're going to test your knees. So try to push your knees out against resistance, please, and back. Okay, great. Now push down on my feet like a gas pedal. Now go up. Okay, what I'm going to have you do is go ahead and stand up for me, please. Go ahead and walk towards me on your toes. If you can. There we go. Now walk back on your heels. You can turn back around. That works too. Now on the outside of your feet, please walk on the outside of your feet towards me. Okay, and turn around and do your inside of your feet. Yeah, there we go. Perfect. Okay. Full range of motion and a good bilateral lower extremity strength, 5 out of 5. This concludes my musculoskeletal exam. Thank you.